that's like a good misconception for like dental hygiene, that just because you don't have pain doesn't mean there's not something going on.
100%. That's my whole thing. That's why I do social media. Not enough people know that. They would say, I'll wait till it hurts. And I'm like, once it hurts, it's infected.
Before we get started with our episode, we're going to hear from our sponsor. Shopify makes it easy to manage your growing business. They help with all the details like shipping, taxes, payments, all from one single dashboard. Their powerful social media tools help you connect all of your channels so that you can make shoppable posts everywhere that people scroll. With Shopify, your first sale is much closer than you think. Sign up for your $1 per month trial period at shopify.com/Rebecca. All lowercase letters. Go to shopify.com/Rebecca to start selling with Shopify today. Now let's get started with this week's episode. I'm just so excited we're finally doing this.
Me too.
Because like we've been planning this for so long.
Yes.
And I'm like a little obsessed with my teeth. So I have so many questions I'm so excited to learn from you.
I can't wait.
How long have you been a dental hygienist?
10 years to this day, almost. It's like 10 years. I graduated in 2020. I graduated in 2015. Now it's 2025.
Wow.
Yeah, but I was in the dental field for a year before that.
What were you doing?
So I was doing dental assisting.
Okay.
So I like to say 11 years.
You always knew that you wanted to do.
So it's funny. I always thought I wanted to be a dentist. So, and then my whole life, like I was in preschool saying, I'm going to be a dentist, you know, the whole thing. And then I did my undergrad, long story short. I did my undergrad and realized I didn't love dentistry anymore.
What did you not love about it?
A lot of things. Okay. Mostly that I knew I'd want to own my own business. Mm-hmm. And I realized that as much as I would want my own business, I didn't want to have to deal with the business stuff.
Correct.
And I was like, And then I started just panicking. Like, this is going to be 4 years. It's like it's like $500,000 every year of dental. Like you're going to be like.
Dental school?
It's so, I don't know. It's a lot of, maybe it's $500,000 altogether.
Is that like to have the business or to go to the school?
To school. So I was I was very stressed over like, I'm about to put so much in loans. What if I hate this?
Yeah.
It just seemed like a really scary, but I knew I loved teeth. So my thought was, I'm just going to go to dental hygiene school first and just like see if I like it.
Yeah.
And if I really love it, then I'll do the thing and I'll go to dental school, blah, blah. But then I got to dental hygiene school. I fell in love with the preventative aspect, right?
Okay.
Because restoring teeth and fixing teeth is so cool, but being able to prevent the teeth from needing to get fixed, I was like, wait a second. I was doing this just because I thought it was a filler, but I love this. And I'm obsessed, and here I am.
Oh my God, I love
10 years
so
later,
much.
Never looking back.
Oh my God. I have so many questions. This is so great.
I love it.
Okay, so when I was a kid, I have very sensitive teeth in general.
Okay.
Right? And so I had a lot of problems with cavities when I was really little because like I loved the junk food and I like didn't understand like how to properly brush my teeth and things like that. And then once I started getting my adult teeth, I'm like very obsessed with, oh my God, I will not go to sleep if I don't brush my teeth at night, and I have to do it in the day, and like if I forget, it's fine. There will be 2 times a day that I brush my teeth.
Yeah.
But now I have a new problem, right? I found that I have perioral dermatitis, which is a skin thing that makes me extra sensitive to fluoride. So then it becomes like, okay, what toothpaste do I use? And like, I have to use the Pronamel and the Sensodyne, and I have to be very careful with what mouthwash that I use. And even when I travel, with the amount of fluoride that people have in the water, different states. So it's kind of a mess of like, now I get really paranoid about like, oh my God, but what about my teeth? You know what I mean?
Oftentimes too, I mean, I'm sure you've looked into it a lot with the dermatitis, but oftentimes it could be SLS. You probably know about the sodium lauryl sulfate.
No, what is
That's like
that?
the main thing. It's usually not the fluoride. It's usually SLS. So it's sodium lauryl sulfate. It's SLS on the tube. And oftentimes when you said you're using sensitive toothpaste, oftentimes sensitive toothpaste don't have SLS. So that will help. Usually it's the SLS that bothers people. Not to dismiss, it could be that you have a fluoride issue as well, but like the number one like studies, everything shows that SLS is the thing that like usually like
what about it like bothers people?
So it's just, you know, it's one of those like allergy, like I mean, I'm not an allergist, like but yeah, it's kind of like, you know, like peanuts, like just it tends to be something that people are allergic to, right? I don't really know the whole background, but I do know that when people use toothpaste that are SLS free, they often don't have problems. So look into that. You know what I mean? There are a lot. I could talk to you later about like
no. Oh my God, this is so interesting. Like literally fascinating.
Yeah. Because
Okay, you said that you love like the preventative aspect
Yeah.
of like taking care of your teeth.
Yeah.
And I got so many questions from
Yeah.
people
Oh, I
that
love
want
it.
to know like they
Can't
want to know
wait.
about cavities. Like
Oh,
what are cavities?
sure.
What are
I
like
love it.
what actually is happening to your teeth? How do you prevent it? Is it like why are some people more prone to them than others?
Mhm.
I want to know everything that you know
Okay.
about cavities.
I love it. Okay. So yeah, I always say I think it's important that we care about cavities
Mhm.
because yes, cavities are a bad thing. But I just need to say after the cavity convo, we gotta talk about gum disease.
Oh, absolutely.
I
Yeah,
will
that's
say,
next.
okay,
That's
okay,
next.
'cause
Oh, we're getting there.
I always argue that gum disease is all your teeth and cavities is usually one.
One.
But
Yeah.
anyway, they're just as important again.
Mhm.
But yeah, so cavities, so they happen, they're literally a cavitation in the tooth, a hole in the tooth. That's what a cavity
Oh,
is.
wow.
If you think about it like the terminology, the technical term, the medical term is dental caries, but cavities is just what we call them because
Yeah,
it's
yeah, yeah.
easier, it's a hole. So it's when tooth decay, which so you eat all the sugars you were talking about, you're eating
Yeah.
all this stuff, and you have all this bacteria in your mouth.
Mhm.
And some people have more of this bad bacteria than others. So some people are more prone to cavities than others because they got rampant bacteria hanging out and eating all the sugars you're eating. They're munching on the sugars too. And then they, lack of a better word, but this is what I say to the kid patients, but it's easier to understand. The bacteria poops on your teeth. It excretes, right? Because it's eating the sugar and it poops. It's like an excretion. And it secretes these acids. And
Interesting.
acids in an acidic environment in your mouth is where cavities form because it's breaking down like anything acidic. We know about acids on
Yeah.
skin even, right? You want a neutral mouth. So when you start having acids, you could get little holes etching through your teeth. Once these holes, so you have your enamel, we've all heard of tooth enamel. Underneath tooth enamel is something called dentin. If these little holes are up in your enamel, it's not the end of the world. They can be reversed. In a sense, they can be remineralized. I hate to use the word reversed, but remineralized. If you're getting these little etches, you could be using fluoride and different remineralizing agents that will keep them at bay and not let them get worse. But if they keep getting worse and worse and worse, or we're not brushing, we're not flossing, we're just allowing this bacteria to keep pooping on our teeth and it goes into the dentin layer, that's when you have a true cavity, and that's when you need to get a filling at the dentist because they need to dig that tooth decay out, all that bad bacteria, poop and all this stuff, and then fill it and clean it up. And yeah. And then if you let it get too big, so some people are like, I don't want to get my filling. I'm going to wait. Never wait. Because if you wait, that bacteria, it's just going to keep eating away and getting bigger and bigger. Now you're going to need a crown. You've heard of a crown because like there's not enough tooth structure to fill. So we don't want that. And then if you wait even longer, then you have another layer called your pulp, and that's where your nerves are. And if the decay gets into there, then we're in root canal territory because it's hit your nerve and it's infected. And then it could cause an abscess. It's a whole thing. So get
so
your
scary.
cavities filled when they're small. Don't wait. There's no reason. They're just going to get more expensive and they're going to get you're going to have a bigger problem.
Okay, I have two questions going
Love
off
it.
of this explanation.
Follow up.
First of all, so would you say that you can like not reverse, you said you don't like the word reverse, but you can kind of like
Remineralize.
remineralize. What are some really easy ways for
Mhm.
people to do that
Mhm.
before it becomes like a full-on cavity? Like what are ways
Yes.
to reverse but not reverse?
The two main things are flossing,
Mhm.
well, and brushing.
Okay.
Home care.
Yeah,
But
yeah, yeah.
I would say so because like statistically most of these cavities are in between your teeth, right? Like so flossing will disrupt that biofilm, that plaque, that bad bacteria. Flossing is everything. That's the
Okay.
one thing. And then of course a remineralizing toothpaste and or some kind of fluoride treatments at your dentist. There's if you don't like the fluoride, there's MI paste. There's all these different prescription things. Talk with your dental provider and they can help you. They'll give you individualized advice, but the general advice is proper home care. That's literally what's going to help you. If you want to add one more thing, I would say swishing with water after you eat. So like anytime you're eating throughout the day, you don't want to like, I just had an orange on the way here and I was like, this is the worst. This is like a very acidic fruit, right?
Yes.
It's healthy for my body, but I just
your
said, yeah,
mouth.
but I was like, I can't just let this orange sit in my teeth. So I took water, I swished really good. I swallowed it. You could spit, whatever. But like you just drink your water, swish, make sure you get as neutral of a pH as you can. There's also something called xylitol. It's with an X, xylitol. It's in sugar-free gums and sugar-free mints. If I had one on me, I would have popped one of those after eating my orange because that will help neutralize the acids as well.
So I heard about xylitol
Yeah.
gum, but there's so much on the
Mhm.
internet of, oh, just chew it all the time. Is that like a thing or it's just after you eat?
Well, we can get into a whole thing. If you're over chewing, you could hurt your jaw, right? Your TMJ issues. Yeah, we've had patients all the time come in like, I'm constantly chewing gum, but my jaw hurts. And we're like, well, that's why. It's just like working out constantly. Like your jaw needs to. So that's the thing.
Interesting.
But I mean, if you want, so if that's one thing. Another thing is it can hurt your tummy. If you're eating too much xylitol, hurt your tummy. It's also really not good for dogs, so be careful, don't leave it out. It's kind of like chocolate for dogs. But yeah, it's not bad, but only after meals is needed. You don't be doing it. Anything that you do too much of is not good.
Yeah.
Everything in moderation is key, right?
Okay, you gave me another question.
Okay.
My friend and I were discussing this on Discord the other day.
Okay.
When it comes to flossing,
Yes.
how do you feel about like regular like flossers versus the water picks?
Oh, okay. Okay. I thought you were going to say string floss versus flossers. Okay.
Also, that
I
too,
love it. I
that
love it.
too.
There's something for everyone, right?
Uh-huh.
I will say that string floss, traditional string that you use with your 2 finger, you do the whole thing. If you can do it right, I do feel that's the best.
Okay.
However, a lot of people can't do it right, whether it's dexterity issues, whether, like maybe they're a kid that didn't figure it out yet, or they're older and have arthritis, or whatever the case. Or if you're just like, I hate it and I'm not going to do it. And I know, you know what I mean?
Yeah.
If you know that about yourself, you're not going to do a good job if you're not barely doing it. So that's when I'm like, okay, at least use the floss picks. You know, those little ones with the on the stick, those easy. Anyone could use those.
Right.
There's better ways to use them than others, but something disrupting. When I like a water floss,
no.
Yeah.
What do you mean by like the correct way? Like what are the ways? What is the incorrect way to floss?
Yeah.
What's the best way to floss?
So it's wrapping around the tooth is the best way.
Okay.
You want to like make your floss into a C shape almost. So you're going up and down to the left and then up and down to the right. I always explain it to my patients like think about actually you're not just popping up and down cleaning food.
Right.
That'll help prevent cavities.
Sides of
but you want to actually scrape off that layer of biofilm and plaque on the right side and then on the left, up and down. A lot of people do the seesaw. They just like go in like that. Movies always do it and it bothers me. Like I saw Jennifer Aniston doing it in a movie recently. I was like, girlfriend,
that's not it.
And I was like, that's not how you floss. You have to go up and down. You're not going side to side. That's not doing anything.
Yeah,
like,
no.
You want to clean, like think about like cleaning something. You're not just like doing that. Anyway, so long story short, that's the right way, but it's hard to adapt sometimes, especially in the back teeth.
Yeah.
Especially in the back teeth.
Absolutely.
So that's when I'm like floss picks sometimes give you that handle and help you get back there. It's harder with floss picks to make that C. But yeah.
But you can if it's like a
you can bend it. You can work with them. There's some again, I'll take anything. We did learn in dental hygiene school, like our teachers would tell us if they're using shoestrings to floss their teeth, so be it. At least it's something. Yeah. However, but if you want to do the most optimal thing, yes, it's string floss. Sorry.
No, it's okay.
Somebody's in my nose. String floss and then the floss picks. And then when I like a water flosser is in combination with a floss pick or something. I don't usually recommend them to be replacing string floss.
Okay.
There's a very small group of people that sometimes I'll be like, all right, we can just water floss and that's as good as we're going to get. But for most people, if your teeth touch, you want to do both. If you're water flossing, I love a water flosser for people with gum disease, gingivitis, any kind of gum issues. The water flosser is so good for your gums. So if you want to do that, keep your gums healthy and then just do the floss pick real quick. You don't have to be perfect with the floss pick. If you're water flossing, just something to pop in to touch that one spot where those 2 teeth meet. That's what I feel more comfortable with. Most dental hygienists kind of agree with that. It can get a little controversial with the water flosser. Believe it or not, everything's controversial. But,
I'm sure.
But the generalized advice is don't be replacing it unless you really are working with your dentist or dental hygienist one-on-one and they figured out a good regimen for your teeth.
That's so interesting because one of my friends was under the impression that in order to be, they were actually under the impression that it was bad for your gums.
The water floss?
Yeah, because they were under the impression that if you had put the intensity high enough to get the plaque off, that then it would just be detrimental to your gums. Is that not the case?
So that's a good point. Again, everything in moderation. I will say you can hurt yourself for sure. Everyone's gums are different.
Right.
There's usually a pressure dial. It's either 1 through 10 or low, medium, high. I always tell my patients, use whatever feels good, like a massage that you're enjoying. You don't need a deep tissue massage where you're powering through like, oh, this hurts. If it's hurting, maybe it can hurt you, right? Because if it's hurting you, it's physically hurting you. You're not like doing anything better. Most of the research on those water flossers are done at number 7.
Okay.
Like 1 through 10, like 7 is usually really, really optimal for the research. Having said that, I have a lot of patients that use 4 or 5 and it's perfect.
Mine's
for
on
them.
6.
Oh, you're perfect. Okay, great. So you're great. Okay. Don't think you ever have to get to 10.
Okay. Oh,
that's not the goal.
No.
I don't know who's using 10. You're probably hurting yourself.
Okay, that makes so much sense.
But some people, they have like removable partials and things like that they really want to like power wash.
Yeah.
There's like different reasons to use it. But for your mouth, I don't ever recommend 10.
Should people put like, this might be a really dumb question.
No, nothing's dumb.
Is it helpful for So is there health benefits to put like either salt water or fluoride or mouthwash in the picks?
So it could, however, it gets so diluted by water.
Okay.
Unless you're like putting a whole thing of mouthwash in there, that's like super wasteful in my opinion. I don't have money to be like doing that.
Yeah, right,
Like,
right.
but if someone wants to, it can't hurt. I think if you really want to get that extra like remineralization or something,
We're going to take a quick break and hear from our sponsor. It's 2025 and a new year means new opportunities. For a lot of y'all out there, I know you've been thinking about one thing over the holidays, and that's starting your own business. But you probably also have a lot of questions. How do I get started? How do I come up with a brand? How do I sell stuff to people? And what am I even going to sell? Take a deep breath, because Shopify's got you. Shopify makes it easy to manage your growing business. They help with all the details like shipping, taxes, payments, all from one single dashboard, which allows you to actually focus on the important stuff like starting and growing the business. Their powerful social media tools help you connect all of your channels so that you can make shoppable posts everywhere that people scroll. With Shopify, your first sale is much closer than you think. Established in 2025. Has a nice ring to it, doesn't it? Sign up for your $1 per month trial period at shopify.com/Rebecca. All lowercase letters. Go to shopify.com/Rebecca to start selling with Shopify today. Now, back to the episode.
what I like to do is put a little toothpaste on my string floss. So you put the toothpaste on your string floss and then up and down, and I think that's even better than putting a little mouthwash in your water flosser. However, if you like the taste of it, you want to put a little salt water or whatever, it can't hurt. Some always read the one you buy because I don't want anyone breaking their units.
Yeah.
Sometimes it will say like don't put blah blah anything but water. You know, some of them have guidelines. You don't want to break your unit. You're not going to break your mouth with putting stuff in there, but you're going to break your unit maybe.
Interesting.
Yeah.
Okay, now back to the original of the two questions. I have the other one.
Yes, there were two.
So if people fill their cavities,
Yes.
is that a forever fix or does that filling ever break down?
Either or. It could. The goal is to have it as long as you can, right? It depends. If you have a cavity when you're 6 years old on your new molar that you just got, right? You got a new adult tooth and you've got a cavity right away. 6 years old, if you live till 96, 90 years, you know, like anything, our bodies, it might break down a little just because that's like a long time.
Right, that's a long time.
But if you're getting cavities, you know, here and there and you're taking good care of them, care is everything. Keeping them clean at home. That it always comes back to home care. But they can deteriorate, one, if you're not taking good care of them, or two, if they're not placed properly, which I hate to like throw my own profession under the bus, but something happens. Sometimes things get contaminated, especially with little kids. It's very hard to keep that area dry. A little bit of saliva in there, it's ruined. So like, you know, to keep things clean, it's really hard. So adult ones usually last longer, I've seen, because like adults can keep their mouth open and like keep it clean. But if you're getting a lot when you're a little kid, sometimes it's tough. But there's so many, there's so many great pediatric dentists that have figured it out and they're gonna be fine. But I don't know.
That's so interesting.
Yeah, I would just say it can happen, but that's not our goal.
I know somebody who got a filling when they were younger.
Okay, sure.
And got a filling, and then years later, once they became an adult, they were someone that didn't go to the dentist for quite a while, but started having a lot of tooth pain in that one tooth. And so it was one of the big like canines in the front. Yeah. And once they became an adult, they started having some tooth pain, and they kind of noticed the tooth looked a little discolored.
Mm-hmm.
And so I guess it's time to go back to the dentist. Apparently, the cavity from when he was a kid was not completely cleaned out. And so they just put a filling and the cavity kept running rampant in their tooth underneath it. And it was just kind of compact in, and it ate the entire inside of their tooth. And that's why it looked discolored, because it was like hollow. Dead. So it was a dead tooth. Not only that, but it was so fragile and thin that when they were eating chips, it kind of like punctured upwards, and didn't really like feel that because the nerves were all dead. So I had to completely get the tooth taken out, root canal like replaced, put like a crown attached to like the little bit of the nerves that were left. But he's like, how was I supposed to know? I thought it was taken care of. What am I supposed to do with that? And
So tough.
that's crazy.
That just shows how important x-rays are, honestly,
Mhm.
because a lot of people tell me, they're like, I don't want them today. I'm not having any problems. And I'm like, here's the thing.
You
We
never
won't know you're having problems until you know. And it's too late.
Crazy.
Like, like we
Yeah.
could, if we haven't, not saying that's your friend's case,
No,
but in some
no, yeah.
cases, it's like, we just need to see what's going on with the roots and with the, that's why we do our routine checkups, because we could prevent that from happening. If we saw something going on funny, we would figure it out, like go in there and figure it out. And that's the whole that's a
Yeah.
great example. I should use that example for when a patient says no to x-rays.
Yeah,
Yeah, like
you
that's
never know.
great.
Like they had a dead tooth, they
Yeah.
weren't having pain
They
because
don't
so
know.
many of the
Yes.
nerves were dead.
Yes. And we could have maybe prevented that. And
Exactly.
it's heartbreaking.
I feel like that's like a good misconception for like
Mhm.
dental hygiene, that just because you
Mhm.
don't have pain doesn't mean there's not something going on.
100%.
Yeah.
That's my whole thing. That's why I do social media. Not enough people know that. They would say, I'll wait till it hurts. And I'm like, once it hurts, it's infected. It's probably infected.
It's a problem.
You want to get these cavities when they're small. So it's like so much cheaper and it's going to be no pain.
Exactly.
Once it has pain, it's hard to get rid of that pain.
Yeah. What are some other misconceptions that people might have about like teeth health, dental hygiene?
Everything. I've heard it all. Like when I'm like,
Okay, I'm ready.
I don't know. Let's think. Brushing harder is better. A lot of people think like scrub brushing, they're gonna remove that food from their teeth or that debris. So you might, but you might also remove some enamel and you're gonna hurt your gums. You can't be like scrub brushing so hard. Also, when you're pressing those bristles so hard that they're splaying flat, the bristles aren't even doing what they're meant to do. They're supposed to be brushing your teeth, not like being splayed flat. Like it's not even doing.
Yeah.
So yeah, I would say brushing harder is like a big one. Using an electric toothbrush, like a regular toothbrush, is another one. When you have an electric toothbrush that either spins or vibrates, if it's a true electric toothbrush, it does the work for you. You just go along from tooth to tooth.
So you don't have to move it at all?
People go like, you move it from tooth to tooth, make sure you get all the angles, but you don't do that with an electric. That's overkill. It really is.
Really?
Yeah.
Oh, I'm doing too much work.
Right, which is something, you have beautiful teeth. Some people, as long as you're not hurting your gums, of course, the biggest thing is routine maintenance. Tell your dental hygienist everything you're doing.
Yeah.
So they clue them in so they can understand why things are going on. You know what I mean?
Yeah.
Clenching, grinding. So many people don't realize they're doing all these things because you're subconsciously doing it at night. And if you're chipping teeth and like sometimes your hygienist might be like, do you know if you clench or grind? And most people go, nah. Because nobody thinks they are because it's happening at night. But then there's clue yourself in, like, does your jaw ever hurt when you wake up? There's all these, so many like things that aren't talked about enough.
What's bad about grinding your teeth at night?
So so many things.
Or just
Of course, you can chip and break teeth. On top of that, it can cause gum recession, where like right where the gums meet the tooth, it can start like receding away, the gums. And then you have more tooth exposed, sensitivity. A lot of people come in thinking they have like a tooth infection. They'll wake up one day and be like, my tooth hurts. And we don't find anything. We do all the x-rays, do everything. And then we ask if they're clenching and grinding. And they're like, yeah, I've been really stressed lately. And it's like, maybe you've just been banging on that tooth. We don't know. Maybe you need a night guard to protect it. Like, so it's like being a tooth detective. You're always trying to figure it out.
So like when you have like gum recession,
Mm-hmm.
what does that mean? And is there a way to fix that? Like how do you deal with that? 'Cause that's an issue that I have.
Yeah.
I have a lot of gum
Okay.
recession.
Yeah. So the biggest thing is wearing a night guard when you sleep. Just to help maybe reduce any more issues to your teeth. Of course, brushing gently. There's all these things. I have a gum recession video. I did it like a book report. I'm trying to remember all my points. But when I tell my patients, I usually can see in their mouth, so I know what they're doing wrong. But when I can't see in your mouth, the generalized things are also just making sure that you can fix it. There are surgeries that they take tissue from the roof of your mouth, your palate, and then they like sew it onto the.
Oh, that's
we try to avoid that. It is. A lot of people say it's more painful on the roof of your mouth, that healing, than the actual, But sometimes it's needed to save your teeth. Because if your teeth are wiggling, because depending on if you have bone loss, there's so many factors. Sorry, it's like not an easy answer, but I guess just make sure you're not doing all that other stuff.
Don't do that.
I will say getting to the root of the reason you're clenching or grinding is of utmost importance, and unfortunately that's like beyond my scope, right? So many people
That's
are
like
like
psychology.
Right. I'm like I
didn't know that clenching did that.
Yeah, especially at night, because you could put forces that you would never do during the day at night because your brain isn't like stopping your body from hurting itself because it's just like focused on sleeping. The forces are wild. I have them somewhere, whatever the forces are, but you can bite through your enamel
so
and chip your
interesting.
teeth. And yeah. So try to like reduce stress or whatever's causing it. There's different things, that's unfortunately, I deal with it. I clench and grind every single night. So I can tell which days I'm worse than others depending on my stress. But I put that mic guard in because I rather grind through that piece of plastic and buy a new piece of plastic every so often versus buying new teeth. You know what I mean?
No, absolutely.
Yeah.
Someone actually sent me a story about how, and it's not necessarily about like the gum recession, but you reminded me by saying like buying new teeth.
Oh, yeah.
This mom brought her kid to the dentist and his teeth were so rotted. They were black. This is a 3-year-old kid.
Yeah.
And so they had to remove all of his baby teeth because they're like, this is not good. And the dentist was like, hey, we need to get to the bottom of why this is happening because when he gets his adult teeth in, like, that's not as easy of a fix. Like, these are going to be permanent teeth. We need to figure out why this is happening, what's going on with dental hygiene to, like, prevent this from happening later. So let's talk about, like, how often is he brushing? What is he eating? And come to find out, all this kid drinks all day at 3 years old is soda, like Coca-Cola. That's all he has all day, and it just completely rotted his teeth. And it's so funny what you said about acidic. Like Coke is so acidic, and it's a 3-year-old. Do they brush their teeth perfectly? No, they do not. And so like all of that acid just sitting on his teeth constantly just rotted right through them. And the doctor said, or the dentist said, "Hey, Mom, we should probably like try to limit this, try to incorporate more water because we don't want this to continue with his adult teeth." And she just kind of shrugs and she goes, "I guess we'll see." And he's like, "Oh no. No."
This is a story someone told you.
Yeah.
I know that breaks my heart. I've seen that, right? In dental hygiene school, we were shown meth mouth versus Mountain Dew mouth.
Oh.
And it looked, you
The
could
same?
barely distinguish.
Okay, explain to people who might not know what that is.
Yeah,
Like what that is. That's
Right.
crazy.
So like you were saying, soda, not only is it very acidic, but it's very sugary. Mountain Dew is one of the most sugary ones, right? And people that drink, there's people that have addictions to Mountain Dew. It's like a thing.
Yeah.
And so people have liters all day just drinking their Mountain Dew.
That's crazy.
And when they take a picture of someone who drinks Mountain Dew all day versus someone who does meth or, drugs, they have like the same look. It's like an awful, just like you said, bombed out teeth. Every single tooth looks like it needs to be removed or it's already falling out. And so it just shows soda is just as bad as like hardcore drugs for your teeth. It really is. So, yeah.
That's crazy.
Yeah, it's a bummer. Again, I'm not saying you can't drink soda.
But everything in moderation.
Everything in moderation is key. Again, swishing with water after. Like you said, the dentist told that little boy, like on point. Like if you want to have 3 years old, that's a whole nother thing. I don't know anything about
that's like a CPS problem.
3 years old. But like if you're, I don't know, like a teenager, you want to have your can of Coke or whatever, that's fine. But try to drink water after, you don't want it sitting on your teeth.
Do you have any horror stories that you've experienced that you're like, I cannot believe this happened today. I cannot believe I've seen this. We don't want to shame patients.
No,
but like
I never would.
We use their stories to warn others on how important this is.
100%. I will say, like, ever since I started doing the social media and stuff, and like on my Instagram, I have so many people DMing, direct messaging me their stories, professionals that follow me.
That's exactly what happened when I was teaching.
Yeah, you're like, wow, I'm starting to forget. Was this me or was this a story someone told me? Because I reenact them.
Yes.
And I like to you do that too.
Yes.
I've seen that.
Yes.
And so I reenact them just to kind of.
It's okay if it's someone else's.
Right. Exactly. It helps professionals know that we're not alone.
Exactly.
And like, I'm not ever trying to make fun of patients, but I'm trying to show like, this is how you. Some of them are so funny.
It uses comedy and storytelling to advocate for like real issues of this is how we're either treating our dentists, our dental hygienists, or this is how we're not taking care of our teeth, or these are things that people don't understand about taking our teeth. Like it's people tend to listen to important messages more if you make them haha a little bit first.
Amen. There we go. So, so I will say some of the things people write in are so funny and like trivial. Like someone ordered a pizza in the chair and like had it delivered to that operatory. Like, oh yeah, sorry, I just wanted here so it's ready for me to take home. Like, silly things like that. But then then there's borderline like very inappropriate, horrible things that people do. And it's so awkward and you have to dismiss them. Just very inappropriate comments. Yeah, gosh, like the worst one, this one was me because I'll never forget. But like when you're taking x-rays and like, putting, they can make you gag and like having men like make very inappropriate conversations like, oh, I bet women are better. They're stupid.
Ew!
Yeah. And I remember being very young in my career, and I like was just like, I didn't know like what to. I was just appalled. I don't know. But now, if someone were to say that to me, I'd be like,
That's
you can't do that, say that anymore. And if you do, I need to dismiss you. You know what I mean? It's not okay. You're one alone with one person in this room. I always talk to my massage therapist, the girl who does my massages, and we always go back and forth on the creepiest things people have said to us because like she's I mean, hers is very different, much more intimate, but ours is pretty intimate too. We're in your face, just inappropriate, and it's like it can happen in any industry, but there is something to say when you're a medical, healthcare, dental, a healthcare professional.
Even just in general, like the amount of weird people that, oh, I bet all the boys pay attention when you were a teacher. And it's like, this is weird. This is weird.
You
Like,
get
do you
it.
not understand? These are
Yeah.
minor kids.
Yes, it's
This,
so. What
it's
are people
always so
saying?
weird when people think it's so cute to be like, oh, well, I bet little Jimmy probably has a crush on his pretty teachers. And it's like, this is weird. Like, this isn't a cute thing. Like, yes, boys are going to think someone's pretty. But like to sit there and act like it's so cute, you do understand the inverse is pedophilia, right? Like, it's not cute. Stop encouraging this to be a thing. Stop telling kids it's so cute to have crushes on adults. Like,
It's creepy.
you can have a conversation about you can have a conversation about it with your kids, but like don't sit there and encourage it like it's weird. Like when the parents have a small kid and they're like, "Oh, that's his girlfriend, it's his teacher." No.
And you're like, no, I'm a professional.
No, this is weird. No parent should be encouraging that. That's dangerous. Oh my God.
Well, and then they turn into like 50, 60-year-old people that are saying that to me, and it's very, yeah, like the weird.
What do you say to someone
Well,
when they do
that's
that?
what I'm saying. Luckily, when I was early on, I was just like, I was freaked out. I would tell my boss after, and my boss is so nice, was like, oh, you
That's not
should have came and
okay.
got me. Like, please next time come
Yeah.
get me. Like, that's not okay. But now I'm very lucky, knock on wood, that like I see the same patient. So I don't usually get anyone
Oh
who's
God. So
who's new or But I've seen I love all my but I will say I get so many messages on people asking me, how do I handle this, Whitney? I'm new.
Yeah.
I've had this patient who keeps requesting me, but like I feel so uncomfortable. They keep rubbing against me. They're licking my fingers. Yeah.
Oh,
Really.
do you have any specific stories that have like really stood out to you of like,
I mean, it's unbelievable.
yeah,
I will say that what was I gonna say? I don't know. I never want to like poke fun at these because this is like such a horrible thing when I make these videos, but I make them to show
it's education.
how many people this happens to. Yes, like all these girls coming together and guys, it can happen to anyone. And saying like, oh my goodness, patients have said that to me too. I'm so glad I'm not alone. I've never spoke up about it because I felt awkward. This is a whole like creepy conversation that gets into a whole thing. But my point is, I'm happy that we could do so many different things with our platform.
Yes.
Like we can do dental hygiene awareness. We can do making people not feel alone as teachers or as dental professionals or whatever, so that you're not alone, and we can like work and figure out ways to like communicate this and make this not an issue anymore.
Well, I think even just, I'm sure so many people never even thought that could be the kind of harassment that dental hygienists could receive.
Yeah.
And the more people that are aware that that's a thing, means like the more people can address it.
Yes.
And like make sure it's like a known thing. Hey, this is like really creepy. People shouldn't do that.
Right.
That's weird. Like really weird.
Yeah, it's scary. It's shocking when you had no idea. But if you are aware that that could happen, let's hope it doesn't. But what are the steps that your office wants to take if something inappropriate happens? That's what's so important.
So other than like the creepy dudes, like sometimes creepy women, because like you can hit male dental hygienists also.
Yes.
What are some other ways that clients might make your job more difficult or uncomfortable or whatever?
Yeah. So all the like inappropriate stuff aside, back to just fun, back to funsies. I mean, not brushing their teeth. I always joke that like, don't lie to your dental hygienist. We know if you don't floss. Like, I know it's like they always say, and people say that, but I feel like you don't really realize, why do they know? It's because like if I blow air on your gums with my little air thing and they start bleeding, I know you don't floss. Like if air makes them bleed. So or I have a lot of people too, like when they floss really good right before their appointment, but they didn't the past 6 months since I've seen them last. And I could tell because you have like trauma and like inflammation all from like just like poking the floss that your gums aren't used to it. I always compare it to working out, right? Like if you're working out every single day, okay. But if you only worked out the day before your like I don't know, your workout session, you're gonna be so sore because you're
Yeah.
not doing it every single day. It's the same thing
Body's
with
not
your
used to
gums. Your
it.
gums, you have to get used to it. Flossing is so important, not only to remove food, we were talking cavities, but your gums, they like to be stimulated, and they have to be stimulated and healthy and brushed, and you want them firm and pink, right? And when they are red and puffy and inflamed, I know that you're not doing something right. So don't lie to me. It's just embarrassing for us all. Like, then I have to be like, oh,
Hey, like, I know you're lying.
yeah, like, it's like, oh, just tell
Take
me.
care of
I
yourself.
will say this day and age, like, other than 10 years ago when I started, nowadays, people are a lot more honest than they used
Yeah.
to be. I don't know if it's just me. Yeah, like, people
No,
will
they
be like,
totally
just to be
are.
honest, I haven't. I'm like, okay, thank you for telling me. Because now we can work on this.
I feel like it's a generational thing where it's okay to it's becoming more okay to admit faults.
Yeah.
Yeah, if that makes sense.
Knowing that, yeah, we're all human. We do
Yeah.
the best we can. We grow and we learn.
Like, I feel like when our parents were our age, like, it was a very much like you want to put your best face forward and you want everyone to assume the best, and now it's much more socially acceptable to admit fault,
Yeah,
if that makes sense.
I
And I
agree.
feel like someone would get really upset with me for saying that.
Oh,
but
I mean, it's just our experiences.
Yeah.
Like that,
Yeah.
I agree. I've had the same experience. I don't know if that's how everyone has experienced it, but
yeah.
I've noticed that in my
Yeah,
small little private
exactly.
practice, so.
Okay, that makes me feel better.
No, for sure. I really do. And everyone's different. There's
Yeah.
always going to be some younger people who are still lying, and there's going to be older people telling the truth.
Exactly.
It's not,
It's
just
not
a
an
generalized.
absolute
Yeah,
statement. It's
but I
just,
have
again,
noticed, like,
social
in
trends.
general, all ages are kind of more just, like, telling the truth.
Yeah, like,
And
it
I'm
is
like,
what
thank
it
you.
is.
I think
Yeah.
we were just all so tired, and we're like, can't follow lies. Lies are harder.
Yeah. Oh my god, they really
Did
are.
I tell her this or that? Like, just tell the truth.
Yeah, just be honest. Like, it's not my
Like, we're not
teeth,
mad at
like,
you. Yeah, like, I'm not mad at you. Like,
they want to know to give you, like, the best advice. And
exactly.
That's totally fine.
Exactly.
But you were really excited to talk about gum health.
I was. I am.
Okay. Tell me all the things. I need to know.
I probably built it up too much, but
No, I'm ready. I'm here for it. I want to learn everything there is to know about gum health.
I just feel like when you go to the dentist, what's the first thing you ask them? You go, do I have any cavities?
Mm-hmm.
That's what everyone asks, and that's fine.
Yes.
I'm not saying that's bad to care if you have cavities, but why is nobody asking how do my gums look? There's more and more research showing that gum disease, the bacteria found in gum disease, directly relates to the bacteria in Alzheimer's disease. And
Really?
there's gum disease, there's associations with increasing your risk of heart disease, diabetes, kidney disease,
Wow.
all these conditions. And, it's not a total correlation causation yet, but there are such strong associations that like,
eventually we
we might find this out. And like, if we have any inkling that keeping your gums healthy might prevent heart disease, why wouldn't we? Like, there's no
makes sense because it's connected to everything.
the blood vessels are all.
Yeah.
Yes.
That makes so much sense.
Yes. And so I'm like, if you don't care about your gums, I just feel like that's it. When people are trying to not have heart disease, right? What are you're told to eat healthy, diet changes, you're told to exercise. These are all big changes in your life. But like brushing and flossing is like a very easy thing, I think, to do that might reduce your risk of heart disease. Why not?
So, like, aside from brushing and flossing, like, what are, because that's a given. We should be doing that all the time.
Yes.
What are some other ways that you can properly take care of your gums?
I mean, eating healthy, of course. Diet is everything. Like, it's pretty, if it's healthy for your body, it's probably healthy for your gums, like vitamins, all that good stuff. You don't want to be eating just like fast food every single day, stuff like that. But, the gums, it really is home care. Okay. Home care is key. I know it's like brushing and flossing. It sounds like a broken record when I keep telling people to do that. But consistency is key. If you skip one night of brushing or flossing, and a lot of people do, we fall asleep. Right? I get it.
Not me. I won't do it. I can't do it. I literally will not go to sleep if I have not brushed my teeth.
I love it. You're on my page. I don't either. Right. I'm the same. I'm like, I would never. However, I know that we're the minority.
Like, I have to shower.
Yeah.
I have to brush my teeth.
I have to do all my
things. Those are the things.
I do my skincare.
Yes.
100%. But there's a lot of people that don't prioritize it, and I get it. Like, sometimes I know I have to brush and floss, but that doesn't mean I want to. I will say I'm not someone who's like excited to do it. Like,
yes.
I know I need to, but I'll never not. So I will say that, like, I know a lot of people, they're just too tired or you've been out or whatever. That one night of skipping, it depends on your mouth, because some people, like we talked about earlier, are more or less prone depending on your bacteria and your saliva and all this stuff. But if you miss one night, it only takes we'll say we'll say 24 to 48 hours as an average.
Okay.
For plaque, which is the stuff you can brush off, for plaque to harden into tartar, to harden into rock like, we call it calculus or tartar. And once this plaque hardens into tartar, you can't remove it with a toothbrush and floss anymore. The only person you have to wait your 6 months until we get in there with our scalers and all of our instruments to remove that properly. So that's why I'm always saying people are setting themselves up for failure, skipping one night, because that stuff starts hardening already. And like, not to say everyone's different. Some people might have 72 hours, but some people, there's some research showing it only takes their mouth 12 hours. So like, it's just so like, you don't know. So why take the chance on how long?
Yeah.
If you skip one night, that stuff starts hardening. Or if you do a really bad job one night, if you just do a quick swipe, like if you didn't remove all that bacteria, because then think about it, when you go to sleep, we're hopefully sleeping 6 to 8 hours, whatever it is. Bacteria love to multiply in dark, wet places. That's your mouth. You're sleeping, it's dark, it's wet. So dry mouth is another, there's all these things. My point is, skipping one night is a lot more detrimental than people make it seem. Like, it really can set you up for a failure.
That's crazy.
Yeah.
And someone wanted to know, is being prone to cavities, like, is that also a genetic thing?
It could be.
Okay.
I would say with cavities, I always, again, everything's, I'm always like thinking about what will people say if I say this.
No, say it.
No, but it's true. I feel what I've read is that cavities are more often than not due to, like, the number one is poor oral hygiene at home. Is there a genetic aspect? Absolutely. However, what is that genetic aspect exactly? It doesn't mean you're doomed. It means you might just need to work. You might be the person who, if you skip a night, you're doomed versus someone who could skip a couple nights. So I'm not saying like you're totally ever doomed. Some people just need to work harder than others. The nature versus nurture of cavities, they're multifactorial. Just because you're genetically prone doesn't mean you're going to get cavities. Because you might be like you and me. We might be genetically prone, but we do everything, you know? But even if we did everything we can, what if we still got cavities? That's when it's like, we need to figure out your saliva. What's going on? Do you just have a naturally acidic pH? Like, what's going on? We need to figure out your saliva. We need to figure out the bacteria in your mouth that may be naturally there. You technically are born without the bacteria that cause cavities, which is like, so many people are mind blown.
Wow.
So you get it from like kissing babies. You just gave your saliva, like, or sharing utensils, or like, it's going to happen. It's kind of inevitable that you'll probably be exposed to this bacteria, but theoretically, you can be someone who doesn't get cavities because you don't really have the bacteria. Having said that, sorry, this is like a 14-parter, but having said that, if you don't have the bacteria and you're not getting cavities, if you never brush and floss, life finds a way. Like, even if you just have like a few, like if you never brush and floss, you will get cavities, just as if someone who's super prone and keeps brushing and flossing might not. So the nature versus nurture is huge, and they're so multifactorial. There's so many factors that go into getting cavities, but you can be more prone.
Okay.
But don't think you're doomed if you are.
No.
Gum disease is different. I will say.
Yeah, I was literally about to say back to gum disease.
With gum disease, I found with my patients, and this is very anecdotal, but I've seen with my patients that, like, if you're struggling with gum disease, it's a lot harder.
So, like, what's, for people that like really don't understand, like, what is gum disease? What does that look like? How do you know if you have it, and what do you do about it?
Yeah. So gum disease, there's different stages. It all starts as gingivitis. Most of us have heard of gingivitis, which is simply red bleeding gums. That's like what it is, red bleeding gums. If your gums bleed when you touch them, when you brush your floss, you have gingivitis. Like, I'll just say this, not that I'm diagnosing, but more likely than not, that is the definition of the word. If you ever, notice bleeding. But if you, gingivitis can be reversed, and you could get rid of it by proper brushing, flossing, getting the proper cleanings you need. There are different types of cleanings you could get at the dental office. And then if it just keeps getting worse, we're not able to manage it, or you just haven't done the steps to manage it, it can turn into periodontal disease, which is like the worst, the gum disease. What it is when your bone, there's bone under your gums up in there that hold your teeth in. And this is when bacteria eats away at the bone. So you start losing bone, as well as the red bleeding gums, all the stuff. You're losing gum, you're losing bone, it's awful. It's awful because it usually doesn't happen on one tooth. It usually happens in sections or your whole mouth. So that's what gum disease is. You're losing bone, which leads to tooth loss. And most of the time, if people are losing teeth, it could be you had a bunch of bombed out teeth from the Mountain Dew or the Coke, like we were talking about. But oftentimes it's because there's no bone to hold them in because of the gum disease.
Someone sent me a crazy gum disease story.
Uh-oh, I can't wait.
She had an older lady come in, And as soon as she got into the chair, she's like, I'm probably gonna need dentures. My teeth are probably gone. Like, they're probably goners. And at first, the dentist and the dental hygienist were like, what do you mean? I see you have teeth.
Yeah.
They just looking at them right now, they look pretty good, but
Yep.
let's go ahead and do some x-rays. Let's take a closer look at this. So on the x-rays, they saw that they had so much bone loss.
Yeah.
So much bone loss in their gums, and they thought, ooh, okay, maybe we shouldn't have told her she's definitely not gonna need dentures. Well, then they go to do their exam. And I learned this just from this story that like,
Okay.
they check for gum health.
Yes,
They take the little pokey tool
She knows.
and they poke the gums,
Yeah.
and if they can go like 1 to 3 millimeters,
Yes!
right?
Oh my gosh, you're so good at
I love learning.
I love this.
1 to 3 millimeters is healthy.
Yes.
Then like 2 to 6 is not, right?
1 to 3 is great. 4 is borderline. 5 and up we don't like.
Okay.
Mhm.
They were able to go 15.
Wow. The highest I ever got was 13. I've never had 15.
15 milliliters.
Yeah.
And not only that, but there was so much bone loss, the mobile teeth, like the teeth were able to just move as if like up and down completely.
No.
And they were like, oh no,
She knew.
we're going to have to pull all of these. This is not good. And she had to go home with dentures that day. But at least like she knew. It's not like she came in and was like, what do you mean? I have great teeth.
Which is great because that could be a shocking thing to tell you
Yes.
that all your teeth are going to fall out. That's a
Yes.
shocking thing to hear.
Mhm.
2 things on your story. One is I've done that before where I'm like, people were so hard on themselves and I'm such like an optimistic, like, you're fine. Your teeth look great. And then I start perio charting and I'm like, no, I know to never say that because it could. Here's the thing with smokers. If you smoke anything, any kind of smoke, it can constrict the blood vessels in your gums and make them appear to look healthy when they're not.
Really?
So a lot of times gum disease goes undiagnosed if you're going to an office that isn't doing the perio charting. Perio charting is the standard of care. If they're not taking those numbers,
And that's when they like poke the gum.
yeah,
Okay.
you know about it.
Yeah.
Some people might not talk about it. Maybe the clinician just does it really fast and like doesn't tell you about it. If you have healthy gums, they just do it and it's fine. But if you suspect they don't, ask if they do at your dental office because that's huge,
Yeah.
especially if you smoke. They might just look and glance and like they did in that store or like I have before where I'm like, oh, it's fine, and then I start perio charting. I'm like, oh no,
Oh.
I have to tell them it's not fine, and so I know to never judge a book until I'm in there. That was one. And 2, I've also had patients where they come for a deep cleaning and, you know, a lot of times they need clearance before certain surgeries, like if you're getting a new kidney or a liver transplant, all this stuff. Kidney, liver transplant.
Yeah.
Anyway, if we've had where we just try to save what we can, even though you know some of these teeth aren't going to make it. You know, like so you usually don't want to waste money. Sometimes it's better to just pull them. But
Right.
some people, it's like, let's just save what I can because it gives me a better chance at getting my liver. You know, like whatever. So I've done cleanings where I have to hold the tooth. So like,
wow.
because it's wiggling so much, like my one hand is holding the tooth and I'm cleaning around it and I'm like, we're doing the best we can. This tooth might come out. Like this is very, very rare. Again, it's usually if someone's waiting for a body implant.
Yeah.
But yeah, I've had it where it's like, wow, this is wild. It's you know, honestly, as like a science brain, I'm like, this is kind of cool. But then I have to remember, like, this is a human, and like, darn it, this stinks. You know, like I feel so bad. Like, there's no way like even if I clean it good, this tooth, you take the wrong bite out of an apple, and you know what I mean. So
Yeah.
but there is something to say. Having teeth in your mouth is always better than having dentures.
Absolutely.
If they're not gonna fall out when you're eating.
What are your thoughts on veneers?
Well, before social media, I was just like, whatever, it's a veneer. You know, it's just another dental procedure. But now that everyone's going to all these places and getting veneers, or even here getting veneers for no reason, I think that's silly. You don't need to get veneers if you have teeth that just maybe need to get whitened.
Yeah.
Like, I think it's a waste of time and money and all this stuff. If you just are like, I don't really love my smile, I just like to take the conservative approach. Why file down all your teeth and put these things on? What if you could just like get braces or Invisalign or something and then do a professional whitening and you'll have beautiful, like, you know what I mean? And I know that's not everyone's option. Like a lot of like child actors and stuff, they couldn't do braces because they've been on the, I know this is like really niche or something, but I just think about this all the time. Like people always making fun of like like Selena Gomez, everyone's been making fun of her like veneers or whatever lately.
Yeah.
And I'm like, this girl's been in the media her whole life. She didn't have time to get braces.
Yeah.
She did what she could to be a Hollywood star. Like her teeth are fine. She has a beautiful smile. I think it's horrible when people disrespect Selena Gomez.
Anyway, love that woman. I love Selena Gomez.
I've just been seeing a lot of the dentists I follow, and I'm like, why is everyone so mad at her teeth? She's a child actor. Yes, if you're a normal like if you're like not growing up in the spotlight, I always say, go for the braces or the Invisalign and then whiten them and then see. Because that's you always want your teeth.
Right.
Veneers are going to have to be replaced every 10 to 20 years, most likely. So if you get them young, that's expensive.
Yeah.
I mean, I want to say this is like very lowballing that each veneer is probably like $1,500.
Wow.
So if you're getting 6 of them, you know what I mean? This is obviously that's why people go to other countries and get them done for cheaper. But now we're finding so many, like the standard of care is so different in every country and like in every state. Honestly, it seems as if lately, but in every country. And sometimes you come back and you need them all replaced because now you start getting cavities underneath because they weren't sealed right. And it's awful and it breaks my heart. And there's veneer techs up in the States now here. We got these veneer techs that are posing as dentists and they're not. They're literally just like, it's like putting a false nail on your teeth. And again, trapping the bacteria. It's so important, like we were talking about earlier, to not have it contaminated. Yeah, and cleaning it and etching and doing all this roughening the tooth stuff. There's so many steps. And yeah, people just getting like a little certification and like, I'm like, wait, there's like dentists that do like 12 years of school, 8 years of school to specialize, to, you know, cosmetic dentists.
Yeah.
I think it's great. If you really want veneers and you go to a cosmetic dentist and this is your resort, like you can't do anything else. This is what you need for the smile you want. Perfect. But social media has made it like a gray area because people are going crazy when they don't need to.
Interesting. Can you think of any other misconceptions that anyone might have about like dental hygiene? If not, that's totally fine. What would just be some like extra tips, tricks, last words that you would want people to know about dental hygiene?
We could talk for 8 more hours about all the misconceptions.
Oh my God. Do I have to come back to Chicago? We do another episode?
We do a whole episode on
for that.
Misconceptions.
I would love to do that.
Yes. I will say one is, here's like my big overall message is, if it sounds too good to be true, it probably is.
Okay.
That's my biggest thing. There's so many whitening gimmicks and purple toothpaste and this and that. If it sounds too good to be true, it probably is. That's all you need to know. However, having said that, like everyone's looking for a shortcut. Okay. And this is what like, I'm like the most like down to, like, I get it. I want shortcuts to like work out too. You know what I mean? Yes. But like brushing and flossing is all we're asking.
Right.
It's like it. Like 2 times a day with the brush, 2 minutes each time. Flossing at least once. Or something. I don't care if it's the pick or just something.
Something.
That's all we're asking. But a lot of people are just trying to find ways to not do that. And making it more complicated for no reason. You know what I mean?
Right.
So like oil pulling has been a thing lately. I don't know if you've heard of oil pulling.
Oh, what is that?
So nothing against it. It's fine if you want to additionally do it, right? If you want to add this to your routine, sure, maybe there's benefits. There's not too much research on it, but like if you like it and you want to swish with coconut oil, that's all. You just like, you swish. All the research is done for 20 minutes of swishing, which is a long time.
That's a long time.
And again, we're talking 2 minutes brushing versus 20 minutes of swishing. I'm like, you're picking this swish. You think that's the easier way? I don't know. Everyone has different reasons for why they're doing it. Some people feel it's more natural. That's fine. But it doesn't replace the manual removal of plaque. Swishing with any liquid, whether it's mouthwash or oil or whatever, it's not going to remove the plaque. Like if you have a piece of bacon stuck between your teeth, you got to
oil's not
pick it out. You can't just swish. So that's my biggest thing is like, there's so many misconceptions. There's so many gimmicks. Just remember, all these companies, they're trying to make money. If it's something that sounds shocking and doesn't seem to like even make sense, you're like, wow, maybe this is the secret. There's no secrets. It's brush and floss.
Yeah, that's it.
That's
literally it.
That's
literally it.
And stay on routine. And stay on routine. That's why I love working with, there's an app, it's called Better Mouth, and I'm the oral health advisor on it.
Okay.
And it's literally an app to remind you to like brush and floss. And you log it and there's streaks and you know, you could be proud. And sometimes they gamify it and they do like giveaways. If you get 30-day streak, you know, you could be entered to win a gift card just to help people brush and floss. Like that's all you need. And like, I love working with companies like that because they're not trying to sell you anything wild.
They just want you
they're
to
just
like
trying to motivate. Yeah. Like when you really do it from the evidence-based standards, like if you want to add in a tongue scrape, love it. If you want to add in mouthwash, love it. But what we just need is people to brush and floss. I think it's 40% of Americans only brush their teeth once a day. So we got a long way to go with the basics before we start doing all this fancy stuff. You know what I mean? Like nothing replaces the basics. Like
40%?
Yeah, that's what a lot. You know, with statistics, you never know.
Anxiety.
But oh, well, when you're in the dental field, you could definitely confirm it because you go, yeah. But
oh my God.
Yeah, so that's my biggest thing is just like, that's all. I know it's annoying and not everyone loves it, but like that's like if you find a toothbrush you like, I don't care what you use. I try not to work with products too often because like I really believe that like You use what you like. I'll tell you what I like for my mouth,
Yeah.
but it doesn't mean you're going to like it for your mouth. Use what works for you. As long as it's evidence-based and it has the ingredients that work, if we're talking toothpaste. But same thing with like toothbrushes. I like when they're ADA approved by the American Dental Association, then they've been tested for safety and efficacy, stuff like that. So if you know the product works, go for it. Use whatever you like. There's not one that's better than another. It's what works for you.
Yeah.
And if you are trying to use a toothpaste you hate the taste of, or it's bothering you, you're less likely, not you, but most people are less likely to brush for the full 2 minutes because they hate it. But if you're using toothpaste you love, you're going to brush for the 2 minutes. It won't be.
Do you want to hear how obsessed I am?
Yeah.
I have to use like the Sensodyne stuff,
Yeah.
right? And it doesn't really lather the way the
Yeah.
other toothpaste
doesn't.
doesn't. And that scares me because I feel like
the SLS.
right.
Sorry.
I feel like it's not. I feel like it's like not enough, right?
Yeah.
So I will brush my teeth the bottom half for a minute and then reapply toothpaste and then do a minute on top because I'm like, I will make sure there's enough toothpaste for all of my teeth. And it's so like I get so self-conscious when I'm like with people and I have to brush my teeth. Like if I'm traveling and we're sharing a hotel room, I'm like, I'm sorry, this is gonna be really weird, but I brush my teeth in 2 parts. I just need you to understand.
That's so fine. I have no problem with that. You're so funny. I will say, if you're using too much toothpaste and it bothers you, this is like a personal, but be careful because maybe too much is bothering you.
No, too much isn't bothering
me. Oh,
it
isn't.
It just
it's
makes
really
me
just
self-conscious.
okay. I'm just like making sure. But yeah, you only need a piece size amount. But if you want to use more, you use more. Whatever makes you happy.
I'm gonna do it.
I love that.
It makes me feel good.
Totally. I always swish with a anti-cavity mouthwash before bed. Well, not always, but oftentimes before bed, just because it's true. It goes back and forth with should you leave the toothpaste on your teeth or should you spit it out and swish it? It's all just, but it's really not important. It's do whatever you need to do. But I would never leave toothpaste on my teeth. I have a sensory issue and I'm like, I want that out.
Yeah.
So I like to swish with a anti-cavity mouthwash and leave that on my teeth and don't like swish with water because it's like nice.
That's what I do. I do like the purple Listerine.
Okay.
That's the one that I use, the Total Care.
Okay. Yeah.
Oh, well, thanks so much for hanging out with
me
today. We're going to have to do a part 2. We're going to have to do a part 2.
There's so much fun. I could talk with you.
Oh my God, I want to know so much. And I want people to put questions in the bottom.
Yeah.
So we can answer the specific questions.
Yes, there's so many. You wouldn't believe how many questions. Because dental health, oral health, we could talk about cold sores, canker sores. It goes on and on. There's so many.
Okay, we're going to have to do this was cavities and gums. And next is going to be canker sores. Yeah, okay. We're going to have
so many things.
Mom, we're going to have to come back to Chicago.
Root canals. We love it. Yeah, come this summer when it's a little warmer.
Yeah,
it's okay today, but you all know. It gets chilly. Thank you guys.
Oh my God, thank you for coming. I'm just obsessed with you.
I love your energy. You're so nice.
I told you we're the same person. Well, thank you guys so much for hanging out with us. I hope you're as obsessed with Whitney as I am. What's your handle for people to find you?
At Teeth Talk Girl.
I love it.
And then I'm Teeth Talk on YouTube.
I love
No girl,
so
just Teeth Talk.
Teeth Talk. Oh, I love it. That's so cute.
We're talking teeth.
I can't talk. It's fine. Have a great rest of your day, everybody. Hope to see you all next week. Bye.